thank you so much for the invitation to speak. I'm Tammy Rowland, and I work at the Freedom Center as Community Care Coordinator and Health and Wellness Coach. And I am the Program Manager for Exercise Medicine. I do the community outreach for the program, as well as the Health and Wellness Coaching. The Freedom Center is, a unique combination of a university fitness center as well as a community resource, community fitness center. And we are committed to improving the health of this community and expanding Freedom's footprint of services. And we realize that, in order to have a meaningful impact on this community, that it's a collaborative effort of services and partnerships and accessible programming. And one of those programs is the Exercise Medicine, or EIM, as we refer to it. And so I'll get into that. And let me start with some, the why behind this program. And some of this collective information may be familiar to you. And that is, I'll let you read on the screen for yourself, but the increasingly sedentary society that we live in and the problems that that is causing. The Department of Health and Human Services has established guidelines that in order to improve and maintain good health, it's recommended that you get at least 150 minutes of moderate activity, aerobic activity a week, in addition to muscle strengthening exercise. Despite the benefits of these recommendations and the consistent exercise, about 80% of the American adult population is not meeting these recommendations. And the impact of that is costly and it's alarming. There are many benefits, as you can see, to physical activity over in that green square. And these are modifiable. Exercise is a modifiable risk factor. And I want to highlight the two at the bottom there, the mental health and immunity. And this is important, especially these days. We have been in this long haul of this pandemic, and the importance of, it's been long cited that physical activity is, effective in managing stress and negative feelings. And physical activity and nutrition are both contributing to a healthy immune system. We want to highlight this because now more than ever, we want to continue to encourage people to exercise, whether they're increasing exercise or maintaining it or even getting a start on it. And that can be from taking a walk around the neighborhood to using bands at home, watching online videos, whatever that is for you. We want to emphasize the importance during this time to keep doing it. In 2007, the American College of Sports Medicine and the American Medical Association collaborated to develop the Global EIM Initiative, and it's based on meeting those physical activity guidelines of 150 minutes per week, and as well as incorporating a physical activity assessment in your regular doctor's visits. So what does this clinic to community care model look like? Well, it starts in the clinic setting, and the health provider will assess your current level of physical activity, other lifestyle risk factors, and possible chronic disease diagnosis. They will prescribe exercise based on your current level of activity and your health status, and refer you to an EIM credentialed facility. And that, in this case, would be the Freedom Center. When the patient gets to the Freedom Center, and we have the opportunity to engage with them, obviously this is the community setting, and this community setting provides the opportunity for this continuum of care, whereas a physician has maybe 15 minutes to go over all the things that you went there for, all these other health, important health issues that you may be discussing. Whether they have this specific training or not, they don't have the time to go over exactly what you need to do. And a person's best intentions, they may not know what to do, where to get started, how to progress in exercise, and really figure out what lifestyle changes they need to make. And that's where we come in. We've got fitness professionals that it's our job to kind of work with people at, where they are, and to get them to, achieve these health goals that they're setting. But when they come to us, they'll meet with a community care coordinator, and the coordinator will do the intake, take a look, gather their risk factors, and confirm the medical clearance, and review all of this information, take it to the EIM team, where we review it and determine what the best exercise programming is. This is a team approach. We have exercise physiologist oversight. We've got EIM certified personal trainers and certified health and wellness coach. The team approach is the patient is simultaneously working with each of these personnel, each of these staff, and to get an individualized exercise plan and meet with them regularly, as well as get nutrition education and lifestyle modification coaching on a regular basis with the health and wellness coach. And it also includes communication at whatever level their healthcare provider will wants to communicate with us. The EIM credentialed trainers, they specifically follow condition management guidelines to exercise prescription, which focuses on exercise response to these specific chronic conditions. This provides emphasis on applying safe exercise progression based on the individual's evaluation. It minimizes risk of injury, as well as allowing the patient to progress safely while enjoying the activity that they're doing and building the confidence and skills they need to maintain these activities. You can see in this slide, this is kind of just a summary of the type of program that we have. This is how Freedom is implementing this program. We're one of 10 organizations that has an official partnership with the Global Exercises Medicine Program. And we provide a 12-week program that has 3 main components, being exercise, nutrition, and the lifestyle behavior modification, all based on the 150 minutes of activity. Our long-term goals are to create a model for other facilities to implement, because we would like to have a larger impact that increases the size of the population that we can impact when we have this replicated in other facilities throughout the county. We would like to see improved chronic disease indicators. We monitor biometrics, and within a 12-week program, we may see some change in BMI or body fat, weight. And long-term, we may see improvement in A1C and blood pressure and things like that. We would also like to see the increased number of providers who are assessing their patients' physical activity levels and referring their patients to EIM programs for that lifestyle change. This is a snapshot of how the program works if you're a participant in the program. And, of course, you start at the clinic and you get to us. We'll do the assessment. We use an in-body machine, which assesses your BMI and body fat and your weight. And throughout the program, you will meet periodically with the trainer to get your individualized exercise plan. You will be expected to keep an activity log, and for those who may, hypertensive, diabetics, we'll look at logging your glucose levels and blood pressure, and some of it's for safety when we implement the exercise. Some of it's just to see how these things are changing. It's for awareness. And on the coaching side, we'll do some food logging based on the client's needs, and there'll be goal setting and these kind of strategies that they can implement along the way to see what works for them, making these small changes that are sustainable in the long run. And that's the goal. Throughout the whole program, the goal is to have some increased self-efficacy, to have that knowledge and confidence that they can continue to progress with the program and keep these these healthier lifestyle behaviors sustained in the long run. Patients do have the opportunity when they have finished the 12-week program, we'll do another in-body assessment where we'll take those biometrics. They do have the option to stay on and for like another 9 months. And the purpose of this is to see the client have increased independence in their activity levels and kind of getting in this maintenance phase of some of these changes they've made. But we're still here as their team, as their support network, to meet with them periodically. It's going to be less frequent than the 12-week intervention, but we're still here to have like that check-in. And, you know, because there will be, life happens, there's always setbacks. And so we're kind of here to keep supporting and to be that support team. We've been working on this program for a couple of years, and we began our first cohort of clients in early 2020. So we had done our recruiting, we had gotten our IRB approval to conduct a research, collect the data, and we have run all the folks through our exercise assessment. So we were fortunate to get that far, and then early March happened. March 13th to be specific, and we had to shut down because of the pandemic. And as you can imagine, we had to put the whole program on hold. During that time, we've had to figure out how can we continue to work with these people, encourage them to be physically active. And we came up with a way to be able to implement the majority of this program in a virtual format. Because of that, we did lose a few folks. So we had a very small first cohort run through this program, but a successful cohort. Some of the results of the findings and the purpose of this was to really, see what the outcomes of this program are in terms of preventing and managing chronic disease, as well as inform us of the program process and how we can improve this program to make it more user-friendly and to get the most benefit out of it. Some of the findings are increased weekly minutes of physical activity. That is our ultimate goal. We saw people's level of activity greatly increase. We saw a decrease in BMI. We also took advantage of this opportunity because of that, going back to that mental health aspect of it, to incorporate some assessments on mood. So what we had our clients do is when they performed exercise, we had them rate their mood on a number scale pre and post exercise, and we did see a good improvement from mood from before starting exercise to how they felt after they conducted exercise. Now we did do a self-efficacy survey to see how that would improve, and we also added the psychological general well-being index, and these are both for kind of on that mental health side. And though we saw positive trends in both of these areas, it wasn't statistically significant enough to really, claim that we saw an increase there. We know that given a small cohort and the challenges that we face, we'd like to continue to take a look at this and see if we can collect additional data to really kind of hone in on that. Some of the challenges we faced, some of them more obvious with the shutdown and the pandemic, our program came to a screeching halt, and we were successful at switching to the virtual format. However, the virtual format also created issues in that it's hard to train people virtually. However, it can be done. And a lot of these folks were really getting outside, and they were able to pick up some weights and bands and things like that to take back to the house and use them there. So we were able to create home exercise programs and communicate with them over Zoom. Because obviously in this group of folks, they're high risk for COVID, and there was a great fear of exposure. As we got towards the end of the 12 weeks, and we do have a handful of people continuing on, they are starting to come back into the fitness center, and that is going really well. I already mentioned the small number of participants. We also, because of the virtual format, again, there was a lot of self-reporting with the activity logs and weight and that sort of thing. So that's always a bit of a compliance issue, and just getting that information back from the clients themselves. And we haven't reached a year yet. For those who've continued on, we've yet to reach a year. So we will do some assessments again at the end of a year. We've done kind of a 6-month point, and then we'll do it again at year and see what data we have to add to our findings. So this is EIM's call to action, and you know, again, emphasizing the need to create you know, this environment where physical activity is part of that physician's assessment, and making it an important part of you know, health and well-being. For freedom, that kind of that response to this call to action was by providing the services at the community level. And we are fortunate enough to be partnered with Kinesiology and Dr. Stroiney, who will be speaking next, who has, you know, together, she has been able to lead us in the research, and we continue to work together to find new ways that we can collect this data and analyze it and improve upon this program. She also provides us with interns, and we've been successful in that area as well. So we continue to work together in that area. And, you know, moving forward, we would love to look at additional partnerships within the universities. We are looking for opportunities to work with faculty and students in the areas of nutrition and public health, and of course, continuing with kinesiology, and even areas in taking a look at the technology side of this with artificial intelligence to gain some immediate, you know, real-time feedback to get applications that our clients can use to make the self-reporting, this logging much easier, and software management. So to working to kind of build these systems into our program. All of these are to say that there are lots of opportunities for students to be involved, to apply, you know, to kind of create their own research study, and to be a part of gaining this real life experience in lifestyle medicine. And so we welcome those additional opportunities to do that, as well as continuing to build our partnerships in the community with medical systems and other organizations that want to be a part of this, whether it's through worksite wellness, physician referrals, and so forth. Moving forward, we currently offer this program all the time. So anytime anybody wants to join and do this program, we do have this program offered for a fee. And as we continue to work on gaining additional funding and grants, that, you know, our ultimate goal is to make this program accessible to the community. It is not currently covered by insurance. And so we look to make this program as accessible as we can and lower the cost as much as we can. In the spring, we will be starting another cohort. And this cohort there's a small chunk of funding that Freedom Center is providing this program that allows us to respond to, or to provide these services to our first responders in the community. So we are looking forward to getting started with another cohort of folks who, you know, deserve this, and we would like to continue to give back in that way. So we are looking forward to that. And that kind of sums it up. Moving into, you know, the next steps, Dr. Stroiney is going to come on. She works with the exercises medicine on campus. So we have a really nice partnership. And, you know, I think we'll save questions to the end, I think we decided. So if you would like to reach out to me, whether you want to participate in the program or you would like to discuss opportunities for collaboration or partnering, I welcome the feedback and the interaction. So my email is here, and I'm sure that you can reach out to Michael at some point as well to get my email. And with that, Michael, I'm going to stop sharing. And I guess we'll move into Dr. Stroiney's presentation. Thank you.
Thank you so much, Tammy. So Deb, good morning. Would you like to introduce yourself and begin?
Sure. So my name is Dr. Deb Stroiney. I work in the School of Kinesiology. I've taught in both the undergraduate and the graduate programs. I work with some PhD students. I was academic program coordinator for a couple of years, stepped down from that role this past year. So I just prepared a little bit of information about what's happening within the School of Kinesiology just in general, and then a little bit of update about the undergrad program, which I'm the most involved in, and then I will also talk a little bit about the exercise medicine on campus and connecting back to some of the things that Tammy talked about today. So I will share my screen as well. All right, so, and please say something if you can't see it, but I'm assuming you can see it. Just a quick update, especially for our alumni who came through the kinesiology programs, whether it was the undergrad or the graduate programs. The kinesiology program is now, well, I should say all the programs are now have formed a school. So we developed the school in the academic year 2019. So as you may remember, if you are alumni or if you're a member of staff or faculty on campus, the school we were in, we were combined with some other divisions, and we're under the College of Education and Human Development. So in 2019, there were 2 schools. Now there is a development of 3 schools. So we are now our own separate school. And within that school, the programs are our bachelor's in kinesiology, our master's in athletic training, master's in kinesiology, and our PhD concentration in kinesiology. You will have seen probably that the master's was called exercise and health promotion, exercise, fitness, and health promotion, I believe. We just went through the CHEV process in the school to actually rename it to a master's in kinesiology. So you'll see that from now on. Over that year of 2019 and 2020, we reorganized our office suite a little bit. You'll see new signage on the SciTech campus that's pointing you in the direction of the School of Kinesiology. On the bottom of the slide here, this is one of our new logos, our running man, and it's on our wall in our office suite now as well, and we use it a lot in our marketing materials. So again, for those of you who are alumni in the kinesiology program, our office suite looks a little bit different. The signage on our campus looks a little bit different. And it's all kind of went around that whole development of us becoming a school. The school director is Dr. Amanda Caswell. She's also the program director for athletic training. Dr. Jacqueline McDowell is now the program coordinator for the undergraduate program in kinesiology. Dr. Joel Martin is the program coordinator for the master's program, and Dr. Nelson Cortez co-directs the PhD program with Dr. Caswell. So that's just a little update about what has happened over the past year, 2 years within our organizational structure. For those of you who've gone through the kinesiology program, we are still accredited. We had our accreditation renewed in spring of 2019, and this is good for 10 years. So we will be an accredited undergrad program for 10 years, which is great. If you don't know much about accreditation, it is a nice thing to have because it really shows that we follow what the experts say should be taught within a kinesiology program to make you successful in your future career paths. Over the past couple of years, we've been trying to make some curriculum revisions so that we could see some changes to our core curriculum that better help our students get where they need to be once they graduate, whether that means opening up some space for them to minor or to pursue courses that they need for graduate school admissions. That could mean that maybe they are we're focusing our curriculum more on concentrations, so that when they graduate, on their resumes and on their transcripts, they'll have a concentration listed, which just makes that a little more marketable when they're applying to jobs. So we are in the process of going through that. Dr. Robeson and some individuals in the College of Health and Human Services have actually come up with a concentration for one of for the BS in community health. So they've actually come up with a concentration for physical activity in public health. They got a grant to work on that this year, and they are putting it through for approval. So this will be a concentration within the other college. So again, as Michael said about working through partnerships and showing how SciTech does partner, and we'll talk about this with exercise medicine too, but within a community health standpoint and working with other colleges on campus, this is another opportunity for us to have some interdisciplinary opportunities with other colleges. I know other things we've talked about within our school was to even do something like this with nutrition or other areas. Just a couple of nice highlights too for those of you who know some of our faculty. Dr. Robeson received a grant this year to take part in teaching initiatives to redesign some online assessments. So he was awarded that this year. And as I said, he was also the one that worked on this physical activity and public health concentration. Dr. Edo is actually an alumni of Mason for all 3 degrees. He got his bachelor's, master's, and PhD here. He just recently presented at the American Kinesiology Association conference about online course delivery for courses like biomechanics and how do we make that go from a face-to-face to an online delivery. So those of you who've taken biomechanics in a face-to-face setting, you know, how would you have had to do it this year? Well, we figured that out for you, and all of us, not just Dr. Edo, you know, he got to present, but we've all done a lot of creative ways to make our courses still experiential, still give you that hands-on experience that you'd need in a kinesiology program during this time where we've had to have a lot of our courses online. And that's just a couple of highlights. There's a lot of stuff going on in our program. A lot of our students are doing great things. A lot of our graduate students and working on their research projects and being involved with faculty are doing a lot of work. So it's really just kind of keeping in touch with what's going on in our department. But those are a couple of highlights that just recently happened. Another thing that's really important to mention, especially on something like a homecoming week and talking to our alumni, is we place 375 interns per year. And a lot of those internship sites are sometimes alumni that have had, you know, have reached out and said, hey, we want some Mason grads. I went to Mason. And it's been great to have that, keep that network going. And that's how much our students are out there in the public too. You know, that's 375 of our students each year out representing Mason, which is, it's really exciting, and it's a great way to promote our school, the SciTech campus, and our school in the university, as well as the kinesiology program. So speaking of that, so how can our alumni stay connected? One of the things that we do ask through our accreditation, we do need to have an advisory board. So those of you who are listening that are alumni, if you would like to be on our advisory board, we are always open to having individuals working out in the field who are Mason graduates be on our advisory board. You would just need to reach out. You can reach out to me or to Jacqueline McDowell, and we can get you set up with being a member of that advisory board. And really what we use for that is the advisory board is our people out in the field. They're the ones telling us, hey, we need students to know this before they come and work for us. And we need you guys to cover this in your curriculum. So that's what we have the advisory board help us with. As I mentioned, internship sites, we can always use more sites. We can always use places to put our students and again, have that network happen. So if any of the alumni or anyone listening has opportunities for interns that would be appropriate for a kinesiology major, please again reach out and we would be happy to set you up. That Dr. Matthew Andry is the internship coordinator, and he would be the one that could set up a site. Also, we do actually really like when we have guest speakers come in, and more we've been really pushing professionalism within our major, and we want to more and more have these guest speakers come in and talk about the professional side of kinesiology. Once you graduate, what is it like to work out there? What are people expecting of you? What does professionalism look like in our field? So always looking for guest speakers. So again, if you're interested in speaking for us in one of our classes, please feel free to reach out. You know, perhaps this is something where we can start to get a list together of individuals who we could always contact to ask to speak in one of the classes. So exercise medicine, going back to what Tammy was saying, exercise medicine is an initiative that is been brought on by the American College of Sports Medicine, and they have their community side, which is a little bit about what Tammy talked about, and they also have an on-campus initiative. So the on-campus initiative is the same as what you saw what Tammy was saying, except it's really promoting this on a university level. What can we do within our university to get our staff, students, faculty up and moving, using exercise as a means to promote health and wellness and improve upon our daily activities of daily living. In last year, 2020, we received silver recognition. So the on-campus program has different recognition levels, bronze, silver, and gold. And depending what you do throughout the year, you get recognized based on that. And so we were able to obtain silver recognition in 2020. I just had to put in our renewal application this past week. So I'm actually hoping we get silver recognition again, because we had a very similar programs. And we'll see what happens, but we usually have a press release if that does occur, and we'll let you know just what we were able to do. So what do we do on campus? Well, it's things like Michael was a part of this. We got together with other departments on campus, the Alumni Association, we got together with the Center for Wellbeing, and we put on a virtual 5K. And that virtual 5K raised money for the food pantry at Mason and the Student Emergency Fund. And that was the first time holding something like this in terms of donating it to that charity. And I think also with the way we did an interdisciplinary way of hosting it was very unique. And we had it in October because October is Exercise Medicine on Campus month. And so it was one of our events that month. We also held some webinars, one for students and one for staff and faculty about exercise medicine. For students, we really focused on the mental health and well-being side of things this year, like Tammy was talking about, really a key point that's needed right now. What are some little things you can do at home just to boost your mood when you know you've been home all day or stressed about this virtual learning atmosphere? And then we ended it with a nice little HIIT workout for the students that they could do at home. So we led them through a workout. So those are the types of things that Exercise Medicine on Campus wants to do and promote, would be activities for students, staff, and faculty that they can take part in on campus. To receive gold recognition, because I know you're all thinking like, well, how do we get gold? It actually comes down to a referral program that Tammy actually discussed that she's working on with physicians' offices. The difference would be the referral program would actually work with our health services on campus. So our health services would assess physical activity of the students or staff or faculty coming to their department and determine whether or not they need more physical activity. And if they do, then they can be referred to the Freedom Center or one of the recreation centers on the other campuses to get a program to be more physically active. So that is how you get gold recognition. And speaking of that, that would be one goal for the future of our program, would be to get that referral system, not just through what Tammy's doing with the community, but also on campus, on SciTech, on Fairfax, on Arlington, would be to start setting up that referral program. And again, speaking of campuses, One of my goals in the coming year would be to set up, it's kind of time for us to set up a committee for this, for exercises medicine, because I have partnerships with Tammy and Michael and Carrie, and we've really done some stuff on the SciTech campus for exercises medicine. But now we need to start to kind of get this going through the Fairfax campus and the Arlington campus, and really get a whole university-wide initiative. I feel like we're still siloed a little bit. So that would be the future of the program, is to really start to push these initiatives campus-wide. Like we did it with the 5K. Now what else can we do this with? And to do that, I really do think we need to have a committee. We need to have members from the different campuses and recreation and some different departments really establish some of these events that we do, really work together on those. So that's where I kind of see the future of the program going, as well as our continued partnership with Tammy and the community program. So even though we're on campus and she's doing community, Freedom Center is a part of our campus. So they do melt together. Like she said, we provide interns. We have been trying to get research assistants to help out with the research of the data collection portion of the research of this. We've tried, we're constantly looking at grants, not just grants through community initiatives, but grants within the college, within the university. So that pretty much wraps up, and please feel free questions if I didn't cover anything.
Let's see now, this question was answered to some extent. With regard to the internships in kinesiology, you mentioned you have 375 students or interns. Where are these sites? Are there sites that are out of state, for instance, for an opportunity where a student might be able to get closer to home to do their internship?
Actually, yes. So the kinesiology program, the students in it take 3 different internship classes while they're here. So it adds up to about 700 plus hours of internship. So their first one is in more of a fitness, general population setting. Their second is a combination of a more clinical atmosphere and sport performance. And then their last one is whatever they want. And it's 400 hours, and it really should be dedicated towards their career of getting experience that they can put it on their resume to say, I worked with a strength and conditioning coach, or I worked in a physical therapy clinic. So a lot of students, because that's one of the last things they can take, and that's one of that course, they can only take one other course with. So a lot of them actually do that one sometimes at home, and they'll do it closer to home because it's usually one of the last things they have to do. Everything is online. They submit everything online. There's no classwork that goes with it. It's really it's almost like having a job. So it is having a job, really. So yes, they can do those out of state. The other 2 internships, it depends when they take it. If they're taking it during the school year, let's say normal times, okay? If they're taking it during the school year and they're on campus, then they are going to be taking their internships within the DMV area. We have had some students this past year who they were at home with online classes. So they actually were able to find some placements close to home, just so that, because of the nature of the situation. But if they are taking it in the summer, they actually do sometimes take it at home and find a placement for themselves at home. A lot of these courses now, like I say, they don't have any classwork associated with them. They do, but they don't have to be in-person classes. It's more things like reflection papers and some group discussions about what's happening at their internships. I hope that answers that.
We talked about going virtual for this past year. For folks that might have portions of that maybe convenient, do you envision any holdover from that experience? I guess the question is around, do you imagine any parts of the EIM program being hybrid, or allow for participation at home or supervision at home, perhaps?
So in terms of the courses, that is one of the things that we are discussing within the school is what do we want to continue to offer online, and what do we want to continue to offer in a hybrid format? Because if you look at a lot of the articles about higher education right now. All schools are having this discussion that this has kind of changed how we look at higher education. We always had online courses that were offered in certain courses and even throughout all of our programs. So we've always had that opportunity. Now it's, what are we going to do in the future? Are we going to continue to offer those? It's going to depend a lot too on the course. It's going to depend on that goal. Like if we start making those concentrations, it would probably depend something a little bit on that too, depending on how our curriculum goes. The other part of it, the exercise is medicine. I think in the future, yes, we should continue to offer some virtual options. Again, we're going to get more participation that way. We're going to get people who are able to do things at home more than come in. And I think Tammy could talk to this a little bit too about with that type of community program. I think she mentioned too, forgive me if you didn't, but I know we talked about how people liked it being online, because again, what happens when we start having that hour-long commute again? What happens when we start to, where we have those busy lives again, where we're not home all the time? Getting something in at home could help that train them the right way.
If you want me to chime in on that, I think the virtual format, especially going hybrid, the success we had was certainly with the coaching. That transitions easily to not just Zoom, but over the phone format. And it does, like Deb said, it saves a lot of time for the commute. People don't have to change. They don't have to, there's a lot of those little logistics that are removed from the equation that make it more accessible. For the personal training, there are points in this program, whether I think we're dealing with on campus with the students or just the community members, there are points in the programming that might be, like an assessment, getting biometrics and that sort of thing, where there are points where it might be more important for them to come in for that one session. And once they get their individualized prescription or they get kind of placed in a program, the Freedom Center continues to have like live streamed classes, whether it's a yoga class or a HIIT class, that type of thing. And I think a nice combination of having the student interns, perhaps, especially in kinesiology, develop like home-based programming that can be easily sent to the clients and to be able to access and do it on their time is nice. And then of course they can always do a virtual check-in with our coach. And I think that and as long as we're open and running, of course they have the option to come in and work one-on-one with our coach. And with a high-risk population, we do all that we can to accommodate these folks and the facility to reduce that risk and that fear.
Thank you. Yeah, one more, and I think you covered this somewhat. Is the program, the EIM program, open for applications from the general community? And how might community members get that information and perhaps apply?
Yes, it absolutely is. Anybody in the community can. It does require a medical clearance. So really that initial process, whereas we would typically have the physicians referring them, if your physician is not partnered with us or is not aware, you can take the information. We have an information flyer that you can take to your doctor and say, hey, I hear about this program. I think this would be good for me. You have that discussion with your healthcare provider and they sign the medical clearance and you come back to us. Right now, it's a paid program we try to reduce the cost as much as we can, and that fluctuates with funding. You contact me. You can contact the Freedom Center and they can get you in touch with me, provide my contact information, but it was that information I had up on that last slide, but you can email me and I will get you started.
Thank you. One more, and this is related. Can EIM then be prescribed by a physician so that there may be some insurance coverage of cost?
I wish that the insurance would cover it. Right now, the exercise portion is not covered by insurance. I don't have an answer as far as health savings accounts. That is a possibility that you could use that if that is part of your plan. You could possibly use it. As far as the health coaching, there is movement in that area. There is a CPT code, medical code now, a level 1 code for physicians to use for health and wellness coaching. And so that is a level 1, so that means the doctors can use that code. It doesn't mean that your insurance will cover it. So the purpose is to get physicians using that code so that we can move the needle to get insurance providers to actually start covering this. That is one of our kind of collective long-term battles that we hope to be able to contribute to. So the more referrals we get, the more we can contribute to that. And that would be for nationally board certified health and wellness coaches or CHWC certified health educators. So this is very early stages of that. But in regards to kind of fighting this uphill battle and moving the needle towards insurance coverage, that is where we stand with that right now. Physical activity, I'm not aware of movement in getting personal trainers and such covered. And this is, along the lines of that global initiative. These are efforts, and we are, one organization that is contributing to this collective research and information. And this is why the data collection, the research, getting grants to continue doing the research is super important to us to keep contributing to these global efforts. I hope that answered the question.